Okay, let's dig into this. Today we're doing a deep dive on Boswellia serrata. You might know it as Indian frankincense.
Right. And it's not exactly new on the scene.
No, definitely not. It comes from trees in places like India, Africa, the Arabian Peninsula, and it's got this really long history in traditional medicine. Think Ayurveda, traditional Chinese medicine.
Exactly. Centuries of use. So our plan today is to look at what the modern research says about its potential benefits based on the sources we've gathered.
And this is where it gets really interesting scientifically speaking. Research points to these active compounds in Boswellia, boswellic acids they're called.
That's right. And these acids, well, they seem to be the key players. They actually interact with a pathway in the body that's central to inflammation and how our immune system responds.
How so? What do they actually do?
According to the research, they inhibit or sort of block an enzyme called 5-lipoxygenase.
5-lipoxygenase. Okay.
Think of that enzyme as like a factory manager for producing these molecules called leukotrienes.
Leukotrienes, and those are the ones linked to inflammation.
Yeah, precisely. They're major drivers of inflammation and certain immune reactions. So by inhibiting that enzyme, Boswellia essentially dials down the production of these leukotrienes.
Okay, that makes sense. And I read somewhere that this mechanism is kind of similar to some common drugs.
It is, in principle. It's similar in the way it targets inflammation, like how aspirin or ibuprofen work. But it's important to note they target different specific pathways. Boswellia focuses on that 5-lipoxygenase and the leukotrienes.
Gotcha. So another tool to potentially manage inflammation, which explains its traditional use and why researchers are so interested. Let's talk specific conditions. Osteoarthritis comes up a lot.
Yes, OA is probably one of the most researched areas for Boswellia. Studies using certain extracts look, well, pretty promising.
Promising how? Like reducing pain.
Exactly, helping reduce pain, stiffness, and actually improving movement and joint function for people with osteoarthritis. The research really seems to back up its use for OA symptoms.
That could be huge for people managing daily joint issues. What about gut inflammation? Things like IBD.
Uh-huh. Research suggests Boswellia's anti-inflammatory action might be useful there, too, for conditions like ulcerative colitis, Crohn's disease, inflammatory bowel disease.
So potentially fewer flare-ups, less pain?
Potentially, yes. Some smaller studies have even shown it might be comparable in effectiveness to certain standard medications, like sulfasalazine or mesalamine. But again, often smaller studies, so more research is needed.
Right. And asthma. Does it connect there too?
It seems like it might. Remember those leukotrienes? They can also cause the muscles in your airways, your bronchi, to contract.
Ah, making it harder to breathe.
Exactly. So the thinking is by reducing leukotrienes, Boswellia could potentially help lessen asthma symptoms, maybe improve lung function. Studies suggest this possibility.
Okay. What about rheumatoid arthritis? That's another big inflammatory condition.
Yeah, RA. There is some research suggesting it could help reduce joint swelling and maybe even interfere a bit with the autoimmune process itself.
I sense a but.
Well, yeah. The results for RA have been more mixed compared to osteoarthritis. It's not quite as clear-cut. Definitely needs more solid investigation.
Understood. Are researchers looking anywhere else? Any other potential uses on the horizon?
They are. There's ongoing work looking into its antioxidant effects, for example, and even some potential anti-cancer activity.
Really? Anti-cancer?
Well, mostly in lab studies so far, suggesting it might suppress tumor growth. And there's some use noted for brain swelling, cerebral edema in brain tumor patients having radiation.
Okay. Interesting, but very preliminary for cancer.
Exactly. For many other potential uses you might hear about, there just isn't enough solid human clinical data yet. Stick with what the human trials show for now.
Good advice. Okay, let's switch gears to practical stuff. Safety. Is Boswellia generally considered safe to take?
Based on the research, yeah, Boswellia serrata extract seems likely safe for most adults. That's when taken orally, by mouth, at typical doses for up to about 6 months.
And side effects. Anything common people should know about?
There can be side effects. Things reported include stomach pain, maybe some nausea, diarrhea, sometimes headache, heartburn, or even itching. Usually mild, it seems.
All right. Now, precautions and interactions. This sounds really important.
It absolutely is. First off, Boswellia might stimulate blood flow in the uterus or pelvis, so it's generally recommended to avoid it during pregnancy and breastfeeding, just because we lack solid safety info for higher doses in those situations.
Okay, avoid if pregnant or breastfeeding. What about medications?
This is critical. Boswellia can interact with certain medications, big time.
Like what?
Well, medications that are processed or changed by the liver,
Mm.
specifically ones metabolized by those cytochrome P450 enzymes. Taking Boswellia could potentially change how your body handles those drugs.
Okay, that affects a lot of common meds. Anything else?
Yes, it might also interact with immunosuppressants, drugs used to dampen the immune system, maybe after an organ transplant or for autoimmune diseases. It could alter how effective they are. And because Boswellia itself has anti-inflammatory effects, it could potentially interact with or maybe even reduce the effectiveness of other anti-inflammatory drugs like NSAIDs, think ibuprofen, aspirin if you take them together.
So interactions are a really significant consideration here. You absolutely need to check with the doctor. What about dosing? It seems like it varies.
It really does. Depends heavily on the specific condition you're looking at and the type of Boswellia extract product. Studies use a pretty wide range, maybe 100 milligrams up to 500 milligrams daily, sometimes split into doses, usually for up to 6 months.
Any specifics like for OA?
For osteoarthritis,
Yeah.
research often uses extracts that are standardized, meaning they guarantee a certain amount of boswellic acids, like maybe 60%.
Yeah.
Doses that might be around 100 to 250 milligrams once a day with food for some types, or maybe 300, 400 milligrams 3 times a day for others. General advice is often to start low.
Okay, definitely complex. Which brings us to a really important health disclaimer. Please remember, all this information is just to supplement, not replace, advice from a healthcare professional. You absolutely should speak with your doctor or another qualified provider before starting, stopping, or changing any treatment.
Yes, and definitely before taking Boswellia serrata, especially if you have any existing health conditions, if you might be pregnant or are breastfeeding, or if you're taking any other medications, because of those potential interactions and side effects we talked about.
Absolutely critical. So, wrapping this up, Boswellia serrata, or Indian frankincense, it clearly has this fascinating history, and modern research is showing real potential.
Definitely, particularly those anti-inflammatory effects driven by the boswellic acids. The research for osteoarthritis looks quite strong, and there's potential emerging for things like IBD and asthma.
Yeah, it's sort of bridging that gap between traditional knowledge and current science, which is always cool to see.
But, as we've stressed, checking with your doctor is non-negotiable. They can help you weigh the potential benefits against the risks, especially those drug interactions, and figure out if it's right for you and what dose might be appropriate.
Right. And thinking about how science is now confirming some of these ancient uses, it really makes you wonder, doesn't it? What other, valuable health insights might be tucked away in traditional plant medicine, just waiting for us to rediscover them?